I'm a 21-year-old male diagnosed with male pattern baldness at age 19. Recession in hairline has occurred rapidly over the past few years. Follicular unit extraction. I've tried almost every treatment there is, including the big three, finasteride, minoxidil, nizoral, and have had terrible side effects with all of them. There is no hair loss in my immediate family. I'm curious as to know if I can get an FUE treatment at this age, taking into consideration that I will not be using any of the three treatments I stated above post-op. Without proper stabilization after the procedure, what are my options as far as maintaining what I have now? Looking for procedure ASAP.
Thank you for your question. You're 21 years old. You described that you've had male pattern hair loss since the age of 19. You've noticed an increased rate of the receding of the hairline. In your history, you mentioned you used the big three of finasteride, minoxidil, and nizoral, and had side effects from all the drugs. And you ask about FUEs, but what I really find very insightful that you're doing is by asking the question, what can you do about stabilization? So I'll share with you exactly how we approach patients like yourself in our practice, and I think you'll find something very interesting in how we approach patients like yourself. I'm a cosmetic surgeon practicing in Manhattan and Long Island for over 20 years. Hair transplant has been a very significant part of my practice. And what I can tell you is that we've developed a solution for people like yourself for stabilization. One of the biggest challenges for any hair transplant surgeon is the rate of hair thinning. Hair transplant, which is very aggressively marketed, is unfortunately does not, or I should say the people marketing it do not counsel very often the need for some kind of stabilization, because within a few years the hair loss will continue and progress, and the hair grafts will become isolated. Many men will not do hair transplants because they're afraid of looking pluggy. The pluggy appearance is because people lost hair so that the hair transplants were left on their own. The procedure that we've developed is something called hair regeneration. Hair regeneration is something that we've developed where we are combining a wound healing material called extracellular matrix, combined it with platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and it's a concentration of wound healing factors. What we do is we've developed an algorithm or a process based on different factors such as gender, age of onset, type of hair, and other factors in our algorithm. And we actually do this as an injection. It's not surgery, but it's an injection. What we have observed is that thinning hairs become thicker. We're able to halt the progression of the hair loss. And in terms of the longevity of the procedure, we have approximately 5 years of data showing that the procedure does last and that people aren't regressing. Now, of course, we treat everybody like an individual, so of course we study individual patterns. There are some people who will do more than one injection based on a very close follow-up process that we do. We follow our patients every 3 months, and we do this with microscopic photos and digital photography to objectively assess how patients are doing. So I think that your concern about the stabilization is well-founded. You're going to avoid a lot of heartache from having a transplant at a younger age and losing your hair and running out of donor area. That's something I didn't mention either. I should, is that the limitation of transplantation is that the permanent zone where the hair is never going to fall out is actually limited, and usually the amount of area that needs to be covered doesn't match the amount of hair available for that coverage. So it's like you're having a limited bank account. So learn more about this new technology called hair regeneration, and about this approach. Now, as far as the longevity, again, I'll mention is that in our practice, what we've been doing is explain to people that if, for argument's sake, there is a regression, if someone were to need to have, let's say, hair injection every 3 to 5 years to keep their hair and to keep their hair thick, that's much more convenient and sustainable than doing a surgery every few years until you're tapped out, which unfortunately many people come to our practice who've had multiple surgeries are in a very difficult position because of that. So I hope that was helpful. I wish you the best of luck, and thank you for your question.